Now, in the fifth and final section of our lecture, Cholesteatoma and chronic otitis media, we will talk about the effect of two very common infectious diseases, tuberculosis and syphilis, on the ear. In this, we will talk about the clinical features and how they are diagnosed and treated, the effects of the tuberculosis and syphilis, and how they can cause otitis media. For tubercular otitis media, the infection is usually secondary to pulmonary tuberculosis. Tuberculosis is the infection caused by tuberculin bacillus, and it mainly affects the lungs. So main site is the lungs. From there it spreads to different, sometimes through bloodstream, to other parts of the body also. And there is tuberculosis of the brain, and there is tuberculosis of the GI tract. So different organs can be affected when it spreads through the bloodstream. So it can reach to the middle ear also through eustachian tube, but the primary site here is the lungs, pulmonary tuberculosis. Blood borne from tubercular focus in the lungs, tonsils, cervical or mesenteric lymph nodes. Pathology is tubercles appear in submucosal layers of middle ear, cleft and caseate. So usually there are tubercles which appear in the submucosal layer of middle ear cleft, and they can cause caseation. Then there is middle ear and mastoid get filled with pale granulation tissues. And mastoiditis is the inflammation of the mastoid process, can lead to facial paralysis due to involvement of facial nerve, post-auricular fistula, osteomyelitis with formation of bony sequestra, and profound hearing loss. So all these are different pathological features. Tubercles are present. There is granulations present, pale granulations, and it can also cause infection of the mastoid. It can cause paralysis of the facial nerve, fistula formation, osteomyelitis, which is involvement of the bone. So all these are the complications of tubercular otitis media, and these are the perforations you can see that involve the different parts. Clinical features, there is ear discharge, perforation, hearing loss, facial paralysis, and you can see this is the discharge, perforation, hearing loss, and paralysis is facial paralysis. Diagnosis and treatment, there is culture is important to find out it's caused by tuberculin bacillus, so we can start with anti-tuberculin drugs. There is granulations present and X-ray chest, DNA probe and polymerase chain reaction from the ear discharge. Treatment is anti-tuberculin therapy, local treatment, and mastoid surgery. All these are done. Then we have syphilitic otitis media. In syphilis, the spirochetes reach middle ear through eustachian tube when syphilitic lesions are present in the nose or nasopharynx. Syphilis has different stages, and in the tertiary or secondary stages, usually it spreads to the different parts of the body. So when it is present in the nose or nasopharynx, then through that nasopharynx it can spread to the middle ear cleft and through the eustachian tube. Infection may also be blood-borne. Definite diagnosis is there is treponema pallidum, immobilization test, and fluorescent treponemal antibody absorption test. So this is for the definitive diagnosis of treponema, TPI, treponema pallidum, immobilization, and fluorescent treponemal antibody absorption test done for the diagnosis of syphilis. Anti-syphilitic therapy with attention to oral toilet and controlled secondary infection should be done. That was all about the otitis media caused by tuberculosis and syphilis and how they are treated and how they can present. So that was all about our topic, cholesteatoma and chronic otitis media. Thank you for watching sqadia.com.